I apologize. I'm not sure what the technical problem was here tonight, but I'm glad everyone can see and hear me. So if you have questions, feel free to write those again. And it looks like some people have gone ahead and already posted one. So I'll take the first one here. Hello, Anthony. Let's see. I had Lyme back in 2009 and was treated with doxycycline. I got almost back to normal a year later with good diet and exercise. Some years later, in 2011, I started smoking weed and eating fast food. One night, I had a bad trip and I was blacking out and my whole system was off. I was freaking out. 2 weeks later, I still wasn't feeling right, so I went to the hospital and they found opiates in my blood. I haven't felt normal since that day. Could my Lyme have taken advantage of the stressful situation and a healthy lifestyle, or could it have been the drugs that screwed me up? That's a good question. So, all right. So the question is, when people get well from Lyme, there are a group of people that I think we can cure. We can treat with antibiotics. They get back to normal or they get back to a good state, and the germ literally is kicked out of their system. There's another group of people, though, that we're not able to give them the cure. What we're doing is we're knocking the germ load down, the amount of germ that's in you. We use the antibiotics to kill the germs, and gradually people will start feeling better as the germs get under control. And then the immune system can step in and kind of wall off that germ, keep it under control. So if you're doing things that impair the ability for the immune system to work, that can sometimes make it so that Lyme will get active again. And one of the biggest suppressors of the immune system can be stress. If you're not getting adequate sleep, that can suppress the immune system. And sometimes diet. You need to be on a healthy diet to help your immune system work well too. So it could have been any number of those things. I haven't seen a relationship between Lyme reactivating and being on opiates or on narcotics. Okay, so I haven't seen that happen. So yeah, it might be related to your lifestyle. It may have triggered everything to get active again. Okay. So the other thing that I would point out, when in my practice, when somebody had gotten to a good place, and I saw them maybe a year or two later, and they were starting to have symptoms returning. It looked like their Lyme was back. What I found about 80% of the time in those patients is that actually what had happened is they started developing too many yeast in their intestines. All right. Now, I know that may sound kind of far-fetched, but let me just talk about that real quickly. So when you have Lyme disease, the main or tick-borne infections or even mold toxicity, the main reason you feel badly is the body's immune system's reactions to that germ. And the immune cells, in trying to get rid of those infections, manufacture a bunch of inflammatory chemicals called cytokines. Now, if you've been on my webinars, you've heard me mention cytokines a number of times. But essentially, cytokines are made by white blood cells when they see an invader, like a toxin or a germ. And they're, on the good side, they're meant to turn on the immune system to fight better, basically. But in certain situations and in certain people, when the immune system isn't doing a good enough job, it's going to try harder and harder, and it's going to make too many cytokines. And it's too many cytokines that make it so you can't think, make it so you're hurt all over, disturb your sleep, give you joint pain, muscle pains, even give you twitching, can give you mental health problems. It's those cytokines that lead to all that, even the thinking difficulties. So now, if we've got another situation going on that triggers more cytokines to be made, it can make it look like your Lyme or your Bartonella got active again, for instance, okay? And so when you've been on antibiotics, even if you used your probiotics, even if you took things to control yeast in your intestines while you're on the antibiotics, there is always a risk down the road that due to disturbances in your microbiome, in the good bacteria that make up your intestines from having been on those antibiotics, that too many yeast may start to grow. And if they do grow, they're going to trigger excess cytokines again. So some things to look at. And the reason I would wonder that with you, if your unhealthy lifestyle involved eating just a lot of alcohol, which is sugar, basically, or eating a lot of carbohydrates, fast foods, or something we call the standard American diet, or we call that the SAD diet. That's your fast foods, your high fat foods, your high carb foods. that's going to possibly feed your yeast, basically. Okay. So symptoms to wonder about that would suggest you might have too many yeast is, are you having more sugar cravings? Do you tend to feel a lot worse whenever you have carbohydrates? Are you having a lot of intestinal gassiness and bloating? And then the other one that can sometimes happen is the yeast release toxins that get into your bloodstream and can interact with your skin, leading to pimples and acne too. All right. So those can be some things that get in the way as well too. All right. So anyhow, think about those, look at those symptoms. And if you have enough things that say yeast, then treat yeast. It may have nothing to do with your Lyme reactivating again. All right. So let me just do a quick screen share here so I'm going to show you some things to look at. All right. We'll see if you guys can see this. What's happened is I got a new computer and it's trying to ask me for a bunch of permissions just to do the screen share. So we'll see if you can see it or not. All right. So take a look. So I'm doing a screen share now, and I'll look back at your comments here in a minute so you can tell me if you did see the screen share or not. Anyhow, I'm looking at treatlyme.net, my Lyme disease information site. And if you click on this online Lyme guide tab, you see this huge drop-down menu. And then there is an area here called the yeast chapter. And in here, I have an article called A Silent Problem Is It Yeast? And another one called Kills and Prevents Yeast. So these are your articles that tell you how to figure out if you have yeast, and also they tell you what to do if you happen to have too many yeast too. Okay. All right, I'm back here again. Let me just see what your comments were. Okay. So I'm just going to type a question here. I just want to make sure. Did you all see my screen share? Okay, good. Robert says it's working. All right, that's good. That's one thing that's going better for me. Okay. All right, so let's go ahead. Let's see, screen share, good. Okay, thanks everyone. I appreciate your comments on that. All right, so let's go to another question here. Hello, Bill. Let's see. Hello, Dr. Ross. I've been on 4.5 milligrams of naltrexone for 6 months. I would like to go off now and see what happens. Can you go off of it totally, or do you have to taper the dose down? Also, if symptoms come back, can you restart at the 4.5 milligram dose? Thank you. So everyone, naltrexone is a narcotic blocker that traditionally is used to help people with addictions, to manage their alcohol and drug addictions. But we use it in Lyme at low doses because it can help modulate the immune system so that it's not so reactive. It can decrease inflammation. It can help decrease autoimmune reactions. It's also useful for people that have mast cell activation syndrome. It can help with that as well too. Usually when we start it, we have somebody start at 1.5 milligrams a day for about 2 weeks. Then we go up to 3 milligrams a day for 2 weeks. Then we go up to 4.5 milligrams a day. What we're doing when we're ramping up, we're trying to make sure there's a dose that you can handle. And although most people can handle 4.5 milligrams a day, some people only handle the 3, and some people only handle the 1.5 milligrams a day. So really, Bill, to answer your question, when we're doing these different doses going up, it's not because we need to necessarily build it slowly. It's that we're testing to see how you're going to respond to it, basically. Okay. So now that you know that you can tolerate 4.5 milligrams, if you were to go on it again, you should be fine, and just go right back to the 4.5 milligrams a day. Also, you can just stop it cold turkey. You don't need to taper off of it. Okay. All right. Thanks for that question, Bill. Good luck to you. Hello, Chris. Let's see. Hi, Dr. Ross. 5 years ago, I had Borrelia band 31, OSPA B IG virus stripe IG positive immunoblood test. It was negative. Let me wait. So you had 31 OSPA. Oh, okay. These were IgGs. Okay, so positive 31 OSPA and OSB. That's how I'm interpreting what you wrote here. It was negative. 2 bands had activity with insufficient intensity. My Bartonella henselae IgG by ELISA was positive. Last month, my IGeneX IgG Lyme immunoblot was negative. Bartonella wasn't retested. I have fatigue, food sensitive, daily headaches, light sensitivity, general disequilibrium, and infrequent room spinning, vertigo spells. Never saw a bite or rash, but there were ticks. My doctors say that positive and negative testing is not as clear cut as we want, and there are serology issues with Bartonella testing, sometimes leading to false positives. They say I have migraines. Funny migraines are treated by symptoms. There is no test. Is it possible to have Bart and not Lyme? Is treatment for Bart henselae different than tick Bart? I'm considering self-treating for Bart anyway. Appreciate your perspective. Okay. So first of all, when we're doing testing with immunoblots or Western blots, we're measuring your body's ability to make antibodies against the infection. And that means you have to have an immune system that works well enough to do it. So in the cases of both Lyme and Bartonella, about 20% of the time when people have Lyme or Bartonella, they will not have a positive antibody or immunoblot test or even an IFA test. Those will be negative, okay? And then often as we treat, if somebody does have those infections, the testing will become positive. As they get less immune suppression, the testing will become positive over the time, okay? Now, if you've ever had a positive test, so when we have positive testing in the beginning, there is an inclination of some of my colleagues to keep retesting to see if a person's getting better. The trouble is antibodies come and go. And so if you're doing the testing to see if the antibodies go away, that some people think that that means the person must be cured, the germ must be gone. I would say that's not necessarily true. Somebody can still have a raging infection in them, suppressing the immune system so that the immune system can't make the antibodies, all right? So we can't really use antibody testing to follow how somebody is doing. It doesn't work, okay? Likewise, there's another test out there which is called an ELISpot test. It measures whether your white blood cells called your T cells have ever had to attack Lyme. And white blood cells that attack Lyme or white blood cells attack any germ circulate in your blood for about 2 months. So if that test comes back positive, it means somewhere in the last 2 months, your immune system has tried to fight that germ. And if it's negative, it can suggest one of two things. Either the germs are gone, your immune system is not fighting them anymore, or there's enough immune suppression going on, even your white blood cells are having a hard time fighting it, okay? So again, even with that, negative testing does not prove that the germs are gone. So we don't have a done test, basically, all right? In terms of can Bartonella, I think you asked, can it be transferred separate? Hold on here a minute. So yes, it is possible to have Bartonella and not have Lyme for a couple reasons. Number one, not every tick that carries Bartonella necessarily carries Lyme, okay? But also, other vectors besides ticks probably are the predominant vectors for how Bartonella is spread. So sandflies, I believe mosquitoes. There's other vectors, biting insects that can carry Lyme, and then or carry Bartonella, I should say. Now, you raise a question: can Bartonella henselae? So Bartonella henselae is a bacteria that can be transmitted through cat scratches. All right, but it also can be transmitted through tick bites, and it also can be transmitted through these other vectors as well too. All right, so it's not specific just for cats, even though it is the bacteria that we say gives a person something called cat scratch fever. Okay, all right, all right. So let's see here. I think I'm trying to see if I got all your question answered. So the treatment for any kind of Bartonella is the same. It doesn't matter whether it's Bartonella henselae, Vinsoni, Elizabethii, any of the strains. We think there may be 15 strains that can infect somebody, and we treat them all the same, basically. Okay. So at my Lyme information site, if you're looking for ways to approach Bartonella, let me just do a quick screen share here for you. Now that I know it's working. All right, so take a look in terms of how do you treat Bartonella. Take a look in my online Lyme guide, and take a look at this section called Infection Treatment Plans, and then go down here to this article called Kills Bartonella, a Brief Guide. I lay out a number of options to treat Bartonella, both herbal and prescription in here. And take a look here. It gives you some guidelines on how to do that. Okay. All right. Thanks for that question, Chris. Oh, I think I just try to get rid of that there. Hello, Sandy. Should herbs for Bart and Babs be pulsed so spirochetes come out and then hit them again with herbs? If so, what herbs would you do this with? It's a good question. I don't think we solidly know. So I have had good success in treating Bartonella and Babesia by doing continuous antibiotics. And the reason my approach has been to do that is if you look at both Bartonella and Babesia, they probably have they regrow about every 24 hours. And so in the periods where you're off of antibiotics, there's a chance it might come back, okay? Now, I know that Dr. Horowitz recently has released another study looking at using what he calls double dose Dapsone along with something called high dose Dapsone. And I have a lot of problems with his study and what he's interpreted as a success. But one of the things he does in his protocol is he has people go on this extensive number of antibiotics and supplements for 2 months to get their germs down. And then during the 9th week, he will have them on a super high dose of the drug regimen, and then he'll stop it. And then about every 2 months, he will repulse with that high dose again. So he's pulsing. And what the reason he's doing that is there is some thinking that Bartonella, especially Bartonella and even Lyme too, that when we use antibiotics continuously, we're sending some of those germs out of a growth state into a persister form. And that if you're off antibiotics, those germs that are hanging out in a persister state, a hibernating state, will wake up, go back into a growth state so that you can go ahead and hit them again with the high doses. Okay, so that's what the rationale is behind that. Now, I understand that rationale, but I have taken care of a number of people that have done pulse regimens for their Bartonella Babesia, and they didn't get better. And so when they come to see me, I just use continuous antibiotics and they do get better. Okay. So it's hard to say. I think whether pulsing works for a person is very individual. It does for some people it doesn't. My concern of pulsing regimens, again, is that you, during the time you're off, a lot of those growing phases of the germ may regrow again. Okay. The other thing that I build into my treatments for Bartonella and Lyme is I have people on agents that kill the growing phases of the germ. And I also have people on agents that are going to treat the persisters at the same time, or these hibernators. Okay. So it's not clear that you need to necessarily let the germs all go back into a growth phase to kill them, because we now have agents like methylene blue, or like cryptolepis, the herb cryptolepis, or like Japanese knotweed that have, or cinnamon clove oregano capsules that have the ability to kill both growing and hibernating or persister forms of these germs. Okay. All right. So I think the jury's out. I hope that answered your question. I think for the majority of people, pulsing doesn't work that well, to be honest with you. All right. I'm do a quick screen share here. So you're probably all wondering, what do you use for persisters, now that I just said that? And so I'll do another screen share here to look at that. All right, so take a look in, we're going to go back to this infection treatments plan section here, and then take a look at this article called How to Treat Persister, Lyme, and Bartonella. I review drug and herbal options to get at the persisters, okay, specifically to target persisters. But when you treat Lyme and Bartonella, you need to have people on agents that are going to treat both the growing as well as the hibernating persister forms of the germ. Okay. And I do it continuously at the same time, actually. All right. All right. So let me go back here. I want to explain another couple things here. Okay. So the world of Lyme and Bartonella changed about 5 years ago when we discovered, well, actually 6 years ago for Lyme and maybe about 3 years ago now for Bartonella, we learned that the germs can be in growing states and that they can move into hibernation, or we call those persisters. Growing germs respond to regular antibiotics. These hibernators tend, because they're not growing, they tend not to respond to most antibiotics. And so the search has been on over the last 5 years or so now to find agents that can deal with the persisters. All right. And so with Bartonella, we now know that methylene blue can be helpful. We know that the combination of azithromycin with methylene blue, or the combination of methylene blue with rifampin, can be quite helpful for Bartonella as well too. We know that the herbs cryptolepis can treat persister, Lyme, and Bartonella. We know the herb Japanese knotweed can treat persister, Lyme, and Bartonella. And we know the cinnamon, clove, oregano oils can be useful at treating growing and persisters. Okay. Now, for Babesia, we have not recognized or are not thinking that there are such things as these hibernator or persisters. All right. So we don't talk about persister or hibernating Babesia. All right. All right. Good luck to you. Hello, Lars. Let's see. Thanks so much for these webinars. What do you recommend for someone who needs to be on 81 milligrams of blood thinner and so many supplements treatments are also blood thinners? Are there tests? All right. So so blood clotting is determined. The factors involved in blood clotting, the big ones are platelets, a type of cell called a platelet, and then also protein called fibrin that binds together with these platelets to form your clot. Those are the two big factors. There's other factors, but those are the two big factors. Okay. All right. So if you, the aspirin is working to make it so that the platelets don't come together as easily. All right. But you still have activity of your fibrin. All right. Now, where you might run into some difficulty is if you're also taking an enzyme that interferes with fibrin or breaks it down, and that would be lumbrokinase. And we sometimes use lumbrokinase to break down fibrin in biofilms, and we sometimes use it to break down fibrin that weaves itself together with Bartonella and Babesia. We call those fibrin nests, okay? The problem would be, so there are other enzymes that will break down biofilms that are not lumbrokinase, and they would be safe to use. Things like serrapeptase, for instance, or nattokinase would probably be, well, no, nattokinase wouldn't be good either. Serrapeptase would be okay. But in general, if you're using a baby aspirin a day, you're probably going to want to be careful about using your fibrinolytics like lumbrokinase, and you should be talking to your physician about whether you should do that or not, okay? You can do it, but you should be doing it under the guidance of a physician, actually, okay? All right. Good luck to you. Hello, Matthias. Hello, Dr. Ross. I'm thinking about taking Bicillin LA injections as an alternative to IV antibiotics. The IV was supposed to be 6 weeks, so I would do the same with the injections. Would that be long enough? And would it be okay to gradually build it up, or does it need to be 3 times a week from the start? My doctor doesn't have much experience with this, so I want to also ask what some potential problems are, things I need to look out for. Thanks for helping. All right. So so the one thing you want to make sure, so Bicillin is a type of injectable penicillin. And you want to use a long-acting variety. And there's 2 kinds of long-acting varieties. There's a product called Bicillin LA, and there's a product called Bicillin CR. We don't think the CR works that well. So make sure it's LA, and I think you are. You wrote here that you'd be doing the Bicillin long-acting, okay? So the way that penicillins work best is, so when you're doing injections, it's another way of getting the medicine into your bloodstream. So you inject it into the muscles, and you get this deposit of the drug that sits in your muscle that then leaks into the bloodstream and can maintain pretty high levels of the drug. And this Bicillin LA, the preparation of it is meant to actually just have the drug slowly leak into your bloodstream. So you can get a pretty high steady state of the drug, basically, probably after about 2 or 3 injections. All right. I am using Bicillin LA. The main thing that you're going to have to deal with is it can be painful. You're going to get little lumps that are going to show up. Okay, that's the main side effect. There's always the risk of having allergic reaction as well too. In terms of can it work as well as IV Rocephin, also known as IV ceftriaxone, in my experience, it can. I sometimes wind up having to use it for a slightly longer period, though, than the 6 weeks that you might use a ceftriaxone for instance. So you might be looking more at 2 or 3 months to get the same degree of benefit, but not always. I've had some people where it worked pretty quickly right away. Okay. All right. So anyhow, I hope that gives you some information there. All right. Yeah. Good luck to you. Hello, Patsy. Hi, Dr. Ross. Thank you for these wonderful webinars. I have 2 questions. Are there any known adverse effects for Lyme patients when they receive the pneumonia vaccine? And 2, what new information did you get recently from the ILADS conference? That's what everyone wants to know. So I'll try to briefly address the second one, but I in terms of the ILADS conference, I really I need to sit down and look at my notes, and eventually I will write an article saying the key new findings that I got out of ILADS. Okay, but regarding your first question, so many of you may be aware of that when people get the flu vaccine. I know your question is about the pneumonia vaccine, but I want to just talk about the flu vaccine. We generally see that people that get the flu vaccine that have active Lyme tend to go into a decline in how they're doing with their Lyme. It's temporary, but they do get a decline that may last a month or so, sometimes a little bit longer. Okay. And so for that reason, since people are aware of that, they then wonder what happens with the rest of vaccines. And frankly, I haven't seen that kind of a decline with the pneumonia vaccine. I have not seen that type of decline with the shingles vaccine in adult patients either, okay? And so when it comes to the flu vaccine, for instance, not the pneumonia, but the flu vaccine, generally, if somebody does not have diabetes, and so the people I would recommend it if they have Lyme would be if they have the following other conditions. So if somebody with Lyme also has diabetes or kidney failure or is 65 years of age and older, those are situations that can interfere with how the immune system works. And therefore, in those situations, I think it is worth taking the risk and getting your flu vaccine. Okay. All right. But, and for most other people under 65 that have no other health problems except for just Lyme, I think I advise my patients not to get the flu vaccine because I've seen too many people go worse after they get it. Okay. Pneumonia vaccine, I have not seen that. Shingles vaccine, I have not seen that. And then with the COVID vaccine, although there is a small percentage of people that did get vaccine injury from it, the majority of people did not have a worsened outcome with their Lyme from having gotten the COVID vaccine. So for instance, if you were a person that got the COVID vaccine and once or twice and did not have a decline in how you were doing overall with your Lyme, chances are the next time you were to get it, if you choose to do that, you would not be having a decline. Okay. So that's just based on my experience. All right. All right. And then regarding new information from the ILADS conference, there wasn't any like major groundbreaking thing. Okay. But just a few things that I'm looking at. So one is, as many of you know, I've been using methylene blue to treat Bartonella and to treat Lyme. And that's because it is very useful at treating growing and persister forms. Okay. There are some other advantages, though, that I've learned more about. So one of the things I've noticed in Bartonella, especially when I use methylene blue, and we've tried other things in people, but we add in methylene blue, I've tended to see a lot of good clearing of cognition and improved thinking that happens. And what I learned, there's actually some reasons for that. So there's a few things that happen. Number one, in addition to killing germs, methylene blue causes the release of nitric oxide. And nitric oxide is good at dilating open your small blood vessels so that you get better blood flow deep into the narrow blood vessels, okay? And that's especially important with Bartonella because Bartonella has two ways that it can limit blood flow into the deeper areas of the brain. One of those ways is that it infects the endothelial cells that line your blood vessels. So those infected cells swell into the blood vessel opening, narrowing blood flow. Okay. Number two, Bartonella forms biofilms, so slime layers that cover the germ. And those Bartonella and biofilms can float, and then they get stuck in the narrow blood vessels because you get these groups of germs and biofilm, and they kind of can clog up your blood flow a little bit too. All right. And then finally, Bartonella can attach itself with fibrin to your blood vessel lining, also narrowing blood flow. So if you can get those blood vessels to dilate open better, you're going to get better perfusion, better blood flow of oxygen into your brain. You might start thinking better. Okay. Other ways that methylene blue can be helpful is it helps your mitochondria work better. And then when it comes, so mitochondria are the energy factories, and often, and when you have an illness that's attacking the brain, it results in the mitochondria not working as well. And the mitochondria are your energy factories. And so if the energy factories are not working well, then you can have sluggish thinking for that reason too. Okay. And then finally, methylene blue has another effect, and that it's known as something called a cholinesterase inhibitor. And so there's a neurotransmitter that is used that is involved in people having Alzheimer's dementia, and that's acetylcholine. And we have found in Alzheimer's dementia, if we can block the destruction of acetylcholine with something called a cholinesterase inhibitor. That increased level of acetylcholine that results will give them better thinking. And so for some people with Lyme or Bartonella, raising acetylcholine may help with thinking as well too. Okay, so I've learned more about what methylene blue can use, and I'm probably going to be more inclined to recommend that people use it actually because of all of these potential benefits that I just stated. Improved thinking, increased mitochondrial function, improved blood flow into the deep areas of the brain. Okay, all right. Another thing that I became very aware of, and this is based on Dr. Mozignani's presentation, Dr. Mozignani being the Lyme guru, he showed a lot of microscopic slides that really show the intensity of biofilm development. And I think it is a huge significant factor. So in the recommendations I've been more recently giving to people since that conference, I'm suggesting that people probably get a little bit more aggressive at doing things that break down biofilm. Okay, so first of all, methylene blue can break down biofilm. All right, Lumbrokinase can break down biofilm. But I'm also looking at having people use a research nutritionals product that works differently than Lumbrokinase and differently than methylene blue, breaking down biofilm. And I would have people take a couple pills twice a day of that. And I would have them take it at the same time that they take the Lumbrokinase, for instance. Okay. All right. All right. And then Dr. Horowitz did present his findings on what he's calling his double dose and then high dose Dapsone treatment protocol. And I have to tell you, I'm skeptical. He's a very huge cheerleader at what he's doing. But the trouble is he presented a study on 25 people that he evaluated based on chart review. And so he, who is the cheerleader of his protocol, is also the one reviewing the charts. There's a lot of potential bias in here, and he's not unbiased about his protocol. So he's claiming with this new protocol of using double dose Dapsone for 2 months, followed by a week of really high dose, and then coming back in and periodically repulsing a high dose, that he's able to get about 35% of people into remission. And then after pulsing, another 35% or so. At least that was the initial read I had on his data. And so that sounds great. I'm sure it sounds great to everybody, but there's some problems there. First of all, he only studied 25 people. And of the 25 people that he studied, all of them were people that could tolerate Dapsone. And we know from his first study that he did on Dapsone, he didn't say too much about it. He claimed great benefits for everyone, even at the lower dose. But the thing is, 50% of people had a drop out of his previous studies because they couldn't even tolerate the Dapsone at low dose. Okay, so if you look at his claim of upward of initially 35% of people just after high dose Dapsone, one cycle of it, getting better. Well, if you throw in the other 50% of people that couldn't participate because they never could tolerate it, you're already down to about 15%. So if you look at all comers, if there truly is any benefit to Horowitz's protocol, it probably is beneficial for about 30% by the time you consider that there's 50% that can't even tolerate it at all. Okay, so I'll put that out. The other thing about his protocol, it's a shotgun approach. He throws everything at a person. And it's just an ungodly number of herbs and an ungodly number of antibiotics. And I'm not sure that needs to be done. And then finally, he is the interpreter of his own data, and he's a cheerleader. So there's a lot of bias and interpretation there. I will eventually probably be writing an article, but I want you to know you're going to start hearing about Horowitz because he's out there promoting it all over the place. I'm skeptical. I'm just very skeptical about it. Okay. So that's my take on that. Let's see. What else did I learn here? Oh, very interesting. There was a cancer researcher showing that if you can maintain healthy gut microbiome, it can help the immune system work better at taking care of cancer. And one of the things that she showed in her studies, and the corollary, this might be something to think about for Lyme, is that one of the best ways to maintain your microbiome isn't necessarily taking probiotics. It's to eat a diet that is rich in fiber, plant-based and grain fiber. All right, so it could be like a Mediterranean style diet, or it could be a plant-forward paleo type diet, but something that is rich in plant-based fruit, vegetable, and grain fiber would possibly be a way of maintaining gut health. And that might be very useful, even in terms of outcome for people living with Lyme too. Okay. Anyhow, those are just some initial things. I have to sit down and see what else I gleaned that it will be changing my approaches here a little bit too. All right. Thanks for that question, though. Hello, Patsy. Hi, Dr. Ross. Thank you for the wonderful webinar. You're welcome. I have two questions. Are there any adverse effects for Lyme patients when they receive the new? Oh, we already answered that. Oh, I just did that. Both parts. I guess I didn't get rid of that. Let me get rid of that. Let's see here. Hello, Mosby. Let's see. No, I'm not suggesting anyone do this, but I ran into a guy who hunts and he goes on the assumption that Lyme is a permanent infection that triggers bring out through your life once you've had it. He puts it back into remission by slow buildup using Banderol, ultimately reaching an amount of triple the maximum suggested dosage. He apparently at one time had access to information, a lot of studies about these herbs, and maintains that their mechanism of action was already studied decades ago for ideas on how to build synthetic medicines. So Mosby, I don't know that anyone has determined the ideal dose on Banderol, which is actually the herb Otoba, or on cat's claw, or on cryptolepis, for instance. Okay. And so generally I shoot on all of on the Otoba and cat's claw, I try to work towards 30 drops twice a day. But I know I've had some people that go up to 30 drops 3 times a day, or 60 drops twice a day, and they may get better benefits. So I'm not adverse to people trying higher doses. I do think you start running into more nausea or potential side effects when you do that. But I will tell you, I don't think no one has determined what optimal doses are on these. Okay. Based on any kind of human studies, I should say too. Thanks for your question. Let's see. Good evening, Dr. Hi, Kelly. Good evening, Dr. Ross. I firstly want to thank you for helping me start to get my life back. Oh, good. A few weeks ago, I joined one of your Q&As to ask a question regarding my mom, who is a Lyme sufferer. Whilst waiting, I heard you describe some Babesia symptoms, which I had never heard before. They were symptoms which I had been struggling with for 18 months, which no doctor had been able to get the bottom of, particularly severe nocturnal tachycardia. I immediately arranged for an IGeneX Babesia immunoblot, which came back positive. I started on cryptolepis 1 teaspoon 3 times a day, and within 2 weeks, the tachycardia had dramatically reduced. 6 weeks in, other symptoms such as dizziness and slow motility are slower to resolve. So I would like to know, how long should I wait before adding in artemisinin or Lumbrokinase? And now that the tachycardia has gone, I'm getting joint muscle aches that I never had before. Is this likely to be Babesia related, or could... Let me see, Kelly, if I can find a second. Yep, there's a second part. Or could it be previously hidden Lyme resurfacing? My IGeneX immunoblot was negative. How does one unpick the various symptoms and know what and how to treat and when? All right. So Kelly, it gets to be tricky and to determine what is there and what isn't. But typically, joint pains are not part of part of Babesia. So you have to wonder about the possibility of either Bartonella or Borrelia. Keep in mind that the cryptolepis that you've been taking to treat for the Babesia also can kill either Bartonella or Lyme. And sometimes what I have found in my practice is when you start treating these infections, it's like peeling the layers of an onion. As you remove one infection, it becomes more apparent based on symptoms that maybe there are other infections involved here too. Okay. Given how you are doing, I would suspect the next step that I would probably suggest for you, because you might be able to just use cryptolepis alone as your anti-Babesia agent, would be to add in the Lumbrokinase that I've talked about before. And we use the Lumbrokinase in the context of Babesia to help break up Babesia fibrin nest. When you start the Lumbrokinase, I usually have my patients start at 1 pill a day because I've seen some pretty significant Babesia Herxheimer reactions. And then I'll have them go up to twice a day as that passes. Okay. Now, as if it becomes clearer based on symptoms that you might have Bartonella or Borrelia, either one of those, one thing you could do then next after, or I would have my patients do after doing a Lumbrokinase, adding that in, if it starts becoming more apparent based on symptoms that there might be a Bartonella or a Borrelia going on, you could add Japanese knotweed. So Japanese knotweed, based on studies that came out of Hopkins now about 2 years ago, these are laboratory experiments, not human experiments. But the laboratory experiments, they were able to show that Japanese knotweed can go after both growing and persister Lyme and growing and persister Bartonella as well too. All right. And, a couple of ways I dose that. Sometimes will work up to 30 drops twice a day. Buhner, as in the herbalist Stephen Buhner, would recommend even starting at a 1/4 teaspoon 3 times a day, and as tolerated going up to 1/2 teaspoon 3 times a day on the Japanese knotweed. But that combination of a crypto and a Japanese knotweed could be pretty effective against Bartonella and Borrelia, growing and persister. And then your crypto would still keep doing the job on the Babesia. So that's something for you to consider as well too. Okay. All right. Good luck to you, Kelly. Thank you for sharing that success. I'm glad to hear that for you. All right, let's see here. Bear with me here. I'm just flipping around. All right. Hello, Jim. Let's see. I have Lyme and Bart perigenics and have been using botanicals and supplements, but considering resorting to pharmaceutical. Just watched Dr. Horowitz discussing double dose Dapsone combination therapy, and it sounds pretty good to me. Well, I think if you were listening in earlier, you heard my comments. I think you have to be very careful at how you interpret Dr. Horowitz's claims of success. And I would also just make you aware that it's a very harsh protocol to try. So, but give it a try. I mean, if that's what you're leaning towards doing, but just be aware my success doing parts of his protocol are not as good as his are. And again, I think that he has a lot of bias in how he's interpreting his data, basically. All right. So anyhow, all right. Good luck to you, Jim. Hello, Rita. Let's see. Do you treat with aqualorin for mold and or Lyme? I'm not familiar with that product or that herb, so I can't say. I don't, but I'm not familiar with it to even make a commentary about it, okay? Sorry about that. Hello, Maria. Let's see. Hi, Dr. Marty Ross. My 12-year-old daughter was having pain every time she has sugar, and you suggested to check for candida. She has candida and mold toxicity. Thank you for the suggestion. They put her on nystatin, glutathione, carboxy, CSM, pure PC, and glutathione assist. She has a lot of joint pain and fatigue. They also prescribed her LDN. Do you think this is a good protocol? So in terms, I'm just looking at this. So you're on the glutathione is going to help with some of the Herx reaction. Cholestyramine may or may not. It's a binder. I'm not sure that it's necessarily needed here, but I don't know enough of the whole history here either. Well, actually, I'm sorry. It's for mold toxicity. Yeah, so cholestyramine is fine for mold toxicity. Glutathione is going to help with the cytokine surges that you're going to see either as part of killing the yeast or from pulling toxins out. So that's good. I'm not familiar with pure PC. Glutathione assist, as I said, makes sense. Low dose naltrexone can help with the immune dysfunction, so it may help with some of the pain. What I am seeing that is weak here, quite frankly, is I don't consider nystatin used by itself to be that effective at getting rid of intestinal yeast. And so they may be starting her on that, and they may go to something stronger down the road, but I usually don't find it to be that effective as an agent by itself. If I'm going to use nystatin, I'm either going to want to combine it with an herbal anti-yeast medication like a Karuna. There's a brand called Karuna, that's Karuna, and they have a product called Capri Plus. Capri Plus has in it garlic, caprylic acid, and some oregano oil. Can be quite effective. And sometimes I'll use the combination of nystatin and that. Or something that's even stronger than that would be to do nystatin along with a prescription of a medication called fluconazole, also known as diflucan. So my only observation, and again, I don't know enough history to say whether I would agree that right now, given how your daughter is doing, this is the way to go or not. But you're looking a little weaker on your yeast killing part of the protocol here. Okay. All right. Good luck to you. Good luck to your daughter. Hello, David. Let's see. Does Lyme disease meet requirements for the right to try for new drugs that have posted the first trial study? I don't know. I mean, I've never looked at that before to see if there could be like a compassionate use exception. I'm not aware of that. I don't know the answer to that for you. All right. Thanks for the question, though. Let's see. Hello, Jim. Again, let's see. Regarding surgery or stressors, I need to finish getting a dental implant. Already had the bone graft, and I'm a few months overdue with getting the implant placed. And then there's another part here that says, I'm 75 and also need cataract surgery. What do you think about going ahead with these procedures? I don't think that treating tick-borne infections and getting cataract surgeries have any adverse reaction either way. Tick-borne infections and cataracts, or getting cataract surgery and outcome on treating your tick-borne infections. Okay. The tooth implants may or may not have an impact. And without being able to get into all of your healthcare, I can't say yes or no. Okay. In other words, I don't get to ask you a bunch of qualifying questions here. All right. So you might try to see if you can find a Lyme literate doctor who can help look at that with you. Okay. All right. Good luck to you. Hello, Sue. Let's see. I was diagnosed with Borrelia, Bartonella, and Babesia in 2017, 9 months after being bitten while hiking in New Jersey. In June, had a heart attack brought on by a clot in the peripheral artery. The cardiologist here in Cincinnati was very good, but completely unaware of Babesia and the connection to heart problems. He told me, you are a mystery and you have almost no plaque in your arteries and your cholesterol is really low, so there is no reason you should have had a heart attack. I'm currently on the standard protocol for normal heart disease patients with the atorvastatin, losartan, Brilinta, and metoprolol. But I'm still very tired and not moving ahead as expected. Cardio rehab is helping, but it is very slow growing. I'm also on LDA and LDI, which both help. My question is this: do you have a recommended protocol for Babesia patients who have had heart attacks? No, I don't. I don't have any one specific protocol. And, but given that you've had some heart issues, this is a situation where you're going to want to be careful and probably work directly with a Lyme doctor to help manage your care. So, I would need to read more. There's different drugs I might use with this combination, but I would want to know more about your health overall by asking a bunch of questions. So I'm not sure what the best way is for you here. Okay. All right. Good luck to you, Sue. Hello, Yelena. Let's see. What do you think about hyperbaric oxygen therapy in Bartonella? Is it true that Bartonella likes oxygen? It's not good for people with Bartonella. I haven't seen anything to say that oxygen is not good for people with Bartonella. If anything, it might have some killing potential. It's an oxidizing agent that might kill Bartonella. But no one's done the studies to say one way or another, to be quite honest with you. But so I do recommend hyperbaric oxygen. It can be useful at getting cytokine inflammation down, especially neurologic cytokine inflammation, so brain. Okay. And then secondly, hyperbaric oxygen helps with a concept called neuroplasticity, where it can help repair nerves that are injured by helping them reconnect with healthy nerves so they function better. And hyperbaric oxygen can help with that. And you can get that kind of injury when you have Bartonella. So on the whole, I think it could be useful for Bartonella. I don't find an indication not to use it for Bartonella. Okay. Hello, Sheila. Hold on here just a minute. Let's see. I've had Lyme for 3 years. I was on tinctures for a year and wasn't getting better, so decided to go to an internist that treats Lyme. He said I also have mold and off the roof SIBO. I'm meant for those right now. He wanted me to try double Dapsone in a few weeks for several months. I took methylene blue for a couple of days and don't think my body liked it too much, so stopped. When I saw the protocol, to be honest, it made me a little nervous. Is there anything better than the tinctures, but not as harsh as Dapsone treatment? I'm a little nervous to take really strong drugs for the Lyme. So, Sheila, there's a lot of alternatives. And that, again, And you heard my comments about Horowitz's Dapsone protocol. It's a very harsh protocol. Again, I think he may be overstating the success he's seeing with it. And I think that there are components of it that may be giving the benefit without the need to actually do the full treatment, okay? You may want to take a look at the various articles I've written about how you treat Lyme and how you treat persisters to find other ideas. You're not stuck having to do a Dapsone protocol, okay? All right. Let me just do a quick screen share where you can look at some options for yourself. Okay, so in terms of treating Lyme, again, there is my section here called Infection Treatment Plans. In my Lyme disease antibiotic guide, I give you a number of options to look at that would treat growing and persister Lyme, okay? I also, if you've got Bartonella, I have this article called How to Treat Persister Lyme and Bartonella, and then I have a separate article on how to treat Bartonella. I am a bit skeptical of Horowitz's Dapsone protocol, and I stated earlier why, but yeah, and I can understand your hesitancy on that. Good luck to you. Hello, Susan. Do you have any suggestions of supplements or other things that help manage cravings for carbs and sugar while treating to rid yeast and candida? You know, I don't. It's a good question. I haven't actually, in all the years that I've treated Lyme, I haven't had somebody actually ask that question. I do think it's a good question. I don't have a good solution for you on that, unfortunately. Yeah. Thanks for the question, though. Good luck to you. Does Nella ask, can I do IVIG and stem cell therapy at the same time? I'm not aware of a reason you can't, but I hope it's a doctor that has experience doing both. Okay? All right. Hello, Susan. My daughter with Lyme, Bart, Babs, yada, yada, yada. In the past year, she's had sepsis 5 times with hardcore last choice IV antibiotics. Only the last time was the culture showing Pseudomonas. She also has shown positive strains of Vibrio, tularemia, Rocky Mountain spotted fever in the last year. Her health is declining and she can't manage the antibiotics anymore. No doctors know what to do. She feels MAID cells are causing her decline. Any opinions? She also had hemolytic anemia, jaundice-like yellow coloration, and weird rash over her liver that comes and goes. That would be hard for me to give you a quick response here in a webinar format with just that much description. I would really need to look at her whole record and ask a ton of questions before I could venture into giving you an idea what I think is the best options here. So I'm sorry, I'm not going to be able to give you help on that one. I'm sorry to hear about this about your daughter, and hope she does okay. Yeah. Hello, Dawn. Let's see. Hello, Dr. Ross. Several questions. Would you please talk about chronic Rocky Mountain spotted fever and best herbal approaches for it? Several Candida species were found in moderate high numbers in the blood test, no vaginal yeast infection, and not noticeable in stool. Is this something to be very concerned about? mixed information found online. Vibrant Labs test of C. glabrata was a 28, C. crucii and C. albicans were moderate numbers in high teens. Any suggestions for the herbs, diet, etc.? Okay. So first of all, I don't consider Vibrant Labs to be a reliable lab. They have done a good job validating their test outcomes for the Borrelia test that they do, but they have not done adequate validation of the other tests that they do. And I'm just not speaking for myself. This would, a number of my colleagues would say the same things too. So first of all, I don't know to trust their results. Okay. Number two, even if you have what they're measuring for these candida infections are antibodies, that doesn't mean that you have the various strains of candida in your blood, but rather it may be that your immune system is reacting to these strains that are growing in your intestines. And so therefore, to help figure out if you need to do something, I would need to know more what your symptoms tell me. So are you a person that's a lot of gassiness and bloating? Do you have a lot of sugar cravings? Do you do a lot worse after you have sugar? Are you a woman that gets a lot of vaginal itching, vaginal discharges? Do you have a lot of pimples or acne that would be caused by too many toxins getting released by the yeast, getting absorbed into your blood, and then interacting with the skin? So I wouldn't treat a test. First of all, I don't trust fibrin. But then secondly, even if these were real, I would want to know what's happening with your intestines, because it's extremely, extremely doubtful that these would be in your blood. If they were, you'd probably be on death's doorstep, literally, like in the hospital on death's doorstep. Okay. All right. Let's see. In terms of Rocky Mountain spotted fever, the testing we have measures whether you have antibodies against it. Okay. And once those antibodies are positive, they're going to remain positive. In my experience, I don't see it being a chronic infection. I find it to be something that if you use a tetracycline, like a doxycycline or a minocycline, and you do for a month or two, you probably have gotten rid of it. And if you still are ill, it might be other problems besides the Rocky Mountain spotted fever giving you those problems. Okay. All right. All right. Good luck to you, Don. Hello, Chris. Let's see. Are there alternatives to methylene blue for opening up the blood vessels, like you mentioned earlier? You know, so it's a good question, because it had me thinking, and I was at ILADS the whole weekend, and so I've been back for a few days, and I've been having to focus on some other projects. But on my list of things to look into is what else would raise nitric oxide. All right. I know that the supplement called arginine can help raise nitric oxide levels. And so maybe that would be something to consider, but I need to look into it a little bit more. Beyond L-arginine, I'm just not familiar with anything else that would do that. But again, I need to look into it too. All right. Thanks for that question, Chris. Is resveratrol made? Hi, Jim. Is resveratrol made from Japanese knotweed developed to substitute for the knotweed itself? No. So the knotweed itself has other components that may be more involved with killing germs than the resveratrol. So I would try to get an extraction that's done from the whole plant, not just the chemical called resveratrol. Okay. Thanks, Jim. Hello, Diane. Let's see. Hi, Dr. Ross. I recently tested a positive. Let's see. I recently tested positive on IGeneX immunoblots, IgG for Bartonella Babesia, and about 6 weeks after last tick bite. Still having fatigue, brain fog, and other symptoms. I'm concerned when we go over the results in a couple weeks. I'm concerned the results will be read like I had these illnesses. but don't have them now since the IgM test came back negative. I had high doses of doxy 2.5 weeks before testing. Can you please speak to IgG being positive and IgM negative and still having symptoms? Yeah. So the general pattern when you have infections, the first set of antibodies you develop are the family called IgM. And we consider those to be the acute infection antibody, okay? And then depending on the infection, somewhere around 6 weeks to 3 months, the IgMs will slowly go away and they'll get replaced by IgG. And once you make IgGs, they will remain, okay? Now, the question is, are you making IgGs because you have old infection that wasn't treated adequately before? You said you've had, the way I interpreted this is that you may have had more than one tick bite, because you said after your last tick bite. Okay. So maybe your IgGs are positive because you've actually had smoldering infection from before the last tick bite. All right. Or maybe you had infections in you and your immune system was doing well, and then you got your most recent bite and your immune system now can't handle what was there before and the new load. Okay. So that's a possibility too. And there's no way of knowing whether that's an increased load or if you had existing load. So that IgG says somewhere in the past you got it. Now, is it possible if you had your testing done at 6 weeks that you're already switching out from IgM to IgG? It's possible. Probably the greater likelihood is this is from previous tick bites. That doesn't mean that you didn't get increased IgG from a new tick bite, because the way the immune system works is if you got a new bite, it would be the existing IgGs that would try to develop it. Your body's not going to go back and remake IgMs all over again. All right. So anyhow, I hope that gives you some information there. Let me see here. Yeah, I could be old, and then you got another bite on top of it that made things worse because there's more germ load now. Okay, it's possible. All right. Okay. Good luck to you, Diane. Hello, Michelle. Let's see. Hello. I was told by a Lyme specialist doctor who treats with the traditional Chinese doctor says I might have Lyme because there's 2 co-infections I have, but tests to confirm are 700 to 1100. Excuse me, 700 to 1100. I can't afford this. How do I know if it's really Lyme? I have felt sick, like I have felt horrible for 2 years. You know, the way we make a Lyme disease diagnosis, there's 4 things that we consider. And we look at these 4 things and it's like putting together the pieces of a puzzle. All right. So number 1, have you ever had a tick bite, or have you had a risk of getting a tick bite? So 50% of the time that people get Lyme, they don't remember a tick bite. And one of the reasons they may not remember it is there's baby ticks that are about the size of a poppy seed. So you might not see them when they bite you. But if you're a person that does a lot of hunting or backpacking or mountain climbing out deep in the woods, you're doing activities that may put you in contact with ticks, baby ticks that you can't see. So I would look at, do you have a risk of getting it? Okay. Number 2, do you have a lot of symptoms that we see in Lyme? All right. And if you do, as part of that, is there anything else that might be giving those symptoms that should be ruled out? All right. Number 3, do you have any physical findings that look like Lyme? So did you have a bullseye rash at one time? All right. And then number 4, is there a supportive test? All right. Now, if it's so you can make a diagnosis of probable Lyme based on the exam, history of potential tick bite, and symptoms. But the best way to know for sure is to get your confirmatory test, is to pay your $700 to $1,100 to see if you really do have it. Okay. That's your best way of going about it. All right. Okay. Good luck to you. Hello, just now. Let's see. What are your thoughts on stem cell therapy and or exosomes or peptides? All right. So Stem cell therapy, there was quite the craze here in the States about 5 to 10 years ago. And there's a group in California called My Lyme Data that has now looked at people that underwent all kinds of alternative therapies. And they've asked them, what happened? Did you get good outcomes or not? And when it comes to looking at people with Lyme and stem cell therapy, only about 4% of people reported benefit. All right. Now, there's some problems though, okay? That is, the type of stem cell therapy that was being done here in the United States at that time was basically taking stem cells from fat or umbilical cords. And so stem cells are supposed to be cells that can develop into anything, but not all stem cells can develop into anything, all right? So umbilical stem cells can develop into what we call connective tissue. Fat stem cells can develop into connective tissue. They don't develop into immune cells. They don't develop into neurologic tissue. They don't develop into muscles, all right? So that type of stem cell therapy that was being practiced here in the States years ago was limited in what it could possibly do, and that may be why only 4% of people got benefit. The best kind of stem cell therapy that can repair the whole host and range of damage that people have, maybe even get the immune system working better, is something called pluripotent stem cells. These are stem cells that literally can develop into anything, okay? And so the most well-known pluripotent type stem cell is an embryonic stem cell. And as you know, here in the States, we don't do that because of the whole abortion conversations, et cetera, right? But you can get it in Mexico, I believe, and in India, you can get embryonic stem cells. And I don't know that we know enough data yet to know what happens when people get embryonic. But if you're going to do it, if you're going to spend the money, I would probably only suggest doing embryonic. I don't think there's benefit for doing anything other than that, okay? Now, in terms of peptide therapies, peptide therapies I'm finding beneficial maybe in about 50% of people. They are not the cure-all. But there are certain peptide therapies, depending on what you're trying to treat, that may give benefit. There are some of those that are available orally as well, too. All right. And then exosomes would be components that you would get along with stem cells. Frankly, I just don't have enough working knowledge of exosomes at this point and what benefit they might have in Lyme and in tick-borne infections. So I can't comment about those. Okay. If you're looking for an article about oral peptide therapies and what they might do for you, let me just do a quick screen share and show you the article I have on that. All right, so this is an article that I've written about peptides. It's called Key Oral Peptide Strategies to Repair and Restore in Lyme and Mold Toxicity. Okay, so take a look here. I review the various kinds that are available orally at this point. I talk about what they might do. And I even give you a strategy down here on how you might consider working with these various oral peptides. Okay. Oh, let me do one other thing here. Oh, so if you're wondering where do you get oral peptides, many of you may know this, but let me go back and re-show that again to you too. Okay, so this is my supplement store. Anyone can buy from me. If you're ever wondering what products do I recommend, you can search for them here in this search bar. Be aware that I offer free shipping, and also I don't make you pay taxes. So that give you some cost savings that way. All the other products I sell here, I sell at the lowest amount allowed by the manufacturers. They won't let me sell any lower than what I offer these for. Okay. All right. So there is a brand of peptides that I carry called integrated peptides. And these are all the peptide products that I mention in that article as well, too. Okay. All right, everyone. That's it for me for tonight. I apologize for the technical difficulties we had here. and I'm not quite sure what to do about it. I've been beginning to think part of the problem tonight may be that I have a new computer. I thought I had it set up all correctly, but maybe not. But I've also been beginning to wonder about possibly moving over to do using Zoom. They have a webinar platform, not Zoom Rooms, but a separate thing called a webinar platform. And I may be looking into that. So I'll keep you posted on that. But for now, we're going to keep working with this platform a little bit longer until I can find an alternative if we need to. Okay. All right. So listen, everyone, good to be with you here tonight. I hope you got some useful information. Keep your eyes out on your email tomorrow morning, where you'll have an email from me with a link to sign up for the next series of webinars for November. And also you'll be able to look at the recording from tonight. That's if the recording went okay. Anyhow. All right. Good night, everyone.